Welcome back from the break, everyone. Thank you for sticking with me through another episode of Independent Thought. My guest for this week is a good friend of the podcast, Estrella. Thank you for coming on the podcast today. How are you doing?
Thank you for having me, and I'm doing okay.
I was asking you to come on the podcast, like a few months ago. You and I had some conversations about some issues you're having with the healthcare industry in Arkansas, and we're definitely going to talk about some of the problems that they're having down in the in the state of Arkansas. But before we do all that, I wanted to first open up the conversation and talk about something more important, which is that you are yourself a writer. And I wanted to just ask you a couple questions about that before we get into this healthcare conversation. What exactly do you like to write about? And could you tell us some of the topics that kind of excite you the most when you do decide to write, whether it's, blogging or whatever else the case may be?
I love giving my opinion on media I consume. So I review lots of media, books, podcasts, TV shows. I also put my own creative writing on my blog as well. And then probably the thing that pushed me the most to start a blog was my love of true crime, and then specifically missing persons cases or unsolved crimes. I love unsolved crimes. However, I've gotten a real passion in the last few years with learning about human trafficking and all of that, and making missing persons cases a huge part of my writing. Right. So every Wednesday and Saturday on my blog, I highlight either a Doe Network profile or someone off of the Charlie Project that's missing. And just to try and bring more attention and eyes to their cases.
Yeah. And that's really important work. So that's really cool that you're doing that. I mean, I just recently did an episode on human trafficking a few months back. It's amazing to me that as widespread as that is, that it's not talked about more, just how prolific it really is, not just in this country, but in every country. But yeah, with all that being said, I kind of wanted to now turn our conversation a little bit towards some of the absurdities that you and I had spoken about before with what you've been dealing with. Just for reference sake, you are down in the state of Arkansas, correct?
Yes, the lovely natural state.
Yes, and you've been having some issues with the healthcare system down in Arkansas that you said were a little bit different than what you experienced growing up in a state like Illinois.
Oh, it is very different going from a blue state to a red state.
Yeah, I think one of the things you had first mentioned to me is that religion is very intertwined with healthcare down in Arkansas. Tell me a little bit more about your experiences with that.
I'm a secular world. So being in the South, especially in the Bible Belt, religion is everything. When you meet someone, the first thing they ask you in the state is, what church do you belong to? Not anything. What church? That's the first thing you're asked. And if you respond, I'm not a part of any church, the look you get is just what heathen are you?
I see.
Unless they're non-religious, they're like, right on. I don't belong to one either. But that's the first question out of someone's mouth, and I'm just like, okay. And so that spills into everything. It's not just healthcare. It's entwined in everything. Growing up in Illinois, teachers didn't talk about their religious preference in school. It's done down here. It's everywhere. Religion is very much part of the everyday life where I'm at. So when it comes to healthcare, I can't just readily go to my doctor's office and get my birth control shot. I have to go call my pharmacy because the autofill isn't set up for the right time for the actual timing of the medication. So I always have to call to have it filled. I have to go pick it up. Then I have to drive to my doctor's office and have them administer it.
So you have to go pick up your own medication from Walgreens, for instance, and then bring it to your doctor because they won't carry it there? Okay.
Because I'm on the depot shot, and their whole thing is because the medical system that I'm part of is owned by a religious organization. And so they don't want anyone preventing babies and everything. So doctors literally can choose if they're going to prescribe birth control or not. And not all doctors will because of their religious beliefs and convictions. Because that's how the entire medical world down here functions, is they get to pick and choose what they will and won't do based on their religious convictions. And it's completely and utterly okay with the legislature.
So I'm going to ask a very, I guess, what's probably isn't an obvious question, but does that make you feel uncomfortable? That
Absolutely.
So when it comes to what goes on down in the medical industry, I know that not only do you have to deal with restrictions on that level, but there's also been some issues that other people are having with, abortion. And there's been more or less, there's been abortion, what we're basically calling bans.
My state's one of the 12 red states that has asked the Supreme Court to overturn Roe versus Wade.
Right. And I think, what was it, the ban that has come through Arkansas recently is another one of those heartbeat bills. And the governor apparently also admitted that the law itself was unconstitutional, but it's still in place anyway.
As he signed it, he said that it was unconstitutional because it did not allow for exceptions in cases of rape and incest. But he signed it anyways. And it's currently on hold because I believe it was the ACLU sued over it. Right. So it's currently been struck down and they're fighting it out in court.
And not only that, but you were also, explaining to me that there is like an Arkansas abortion support network, which has to essentially send people outside of the state just so they can receive abortions if they need them or want them.
They were helping people because of the restrictions that were already in place in Arkansas. They would help people that were outside the limits that Arkansas had already placed. They were helping transport them to states that would get them care. They also provide transportation because there are so few abortion clinics in the state that they will also provide transportation to those.
It's unimaginable to me that healthcare should be so dramatically different from state to state.
The fact that there's not even a Planned Parenthood clinic in my state bothers me.
Right. It just honestly is one of those things where, for me personally, I understand states' rights to a degree, but I feel like there are certain things where, like, it shouldn't be this much of a factor, if a factor at all. Like, healthcare should not be one of those things where, like, oh well, I can't get the healthcare that I need because I live in Arkansas. Like that shouldn't make any sense, that you can receive certain healthcare in a place like Illinois, but you can't receive it in Arkansas.
I currently can't afford therapy in Arkansas because the way it's structured.
Right. And, on top of that, not only are you having to deal with it on that level, but you were also explaining to me that your family is currently dealing with, a crisis because of the restrictive, I guess, like insurance practices in the state as well. Can you tell me a little bit about that story, if you're willing to, and just how exactly that's impacted like you and your family?
Sure. I had a family member who had a mental health crisis, and being on state aid, it's not the greatest insurance out there.
Right.
And so they initially were in a crisis facility, and it was obvious they needed longer care. But because of the way insurance works here, I had to have them come out of the facility so that way we could sit here, fight with the insurance to get an assessment. So that way they would determine, does this person need additional care? Okay, so we go through this assessment, and then I guess there's tiers to this and everything. Right. So depending on what tier you are is what they'll pay for. And so we go through this assessment. Mind you, it takes 2 weeks to get the assessment. Then it takes, anywhere from 2 to 3 weeks after the assessment's done for them to make their determination. So then once we got the assessment done, got the determination back, which I find hilarious that with this determination, they qualified for other health insurance where there is no limit on as many prescriptions as you can get in a month, while
Yeah.
currently here in the state on regular insurance, it's 3 prescriptions unless you have your doctor apply for extra slots, and you only get 6 max.
Okay.
So if you take more than 6 medications, you're basically SOL in the state.
Really?
You have to pick and choose in what you get each month because they won't cover everything.
Okay. And how did that impact, your family member who's dealing with this crisis?
The delay in care doesn't help.
Yeah.
And everything, to me, it just makes the problems worse, because then it puts stress on the rest of the family who's trying to, hold it together until they can get there. So, it weighs heavily.
Right.
But, thankfully with this new insurance, they're able to go into the facility for a longer period of time. They don't have to pay, there's no cost now. So if they're insured, they also have a care coordinator for the family member. So like if I don't feel they're getting the care they need or whatever, I can call the care coordinator and be like, hey, we're having these problems. Can we change facilities?
Right.
And they'll arrange that. But I had to pull teeth to get them into a facility to begin with. And it's like, why can't we all just, have a care coordinator that just makes our lives easier? Because, once that went into place, because they started making the calls.
Yeah.
They started hounding people for answers and responses and things. So the rest of us didn't have to.
Right.
And it's just like, I shouldn't have to jump through all these hoops to get someone to like help and do something. And the saddest part was the care coordinator and their supervisor cared more about trying to get me help than anyone else around. Right. That I was asking for help.
So the facility was able and willing to help, but everyone else involved was kind of just more or less.
No. The insurance was willing to do what they could to help me. The facility blew me off.
Oh, I'm
kept
sorry.
Telling the insurance that they would call me to set up things, but that took 2 extra weeks. People were telling me to call crisis lines. I would call crisis lines and they're like, but you're not in immediate danger, so we're not going to do anything. Just like, yeah, is that a complete loss?
It's horrifying because, personally, whenever I hear about conversations involving in and around healthcare, the conversation is always about the cost, right? Mm-hmm. So we always talk about, well, is healthcare affordable? Is healthcare putting people through bankruptcy? And those are all very valid conversations because the cost of healthcare is enormous, but quality of healthcare is not talked about enough because there are such distinctions depending on where you are. It feels as though there are just certain people in our country who are not getting adequate healthcare all over the place, especially when you're going through a time of crisis. And unfortunately, it does seem like this again, seems very state to state, where certain states just seem to have better healthcare facilities than others. And it doesn't make a whole lot of sense.
We're also having the issue where they can't keep their facilities staffed enough.
Right.
So like recently when I had to cancel our interview the last time, I had a sinus infection where I wound up with a swollen lymph node, like in my arm here, to where like I couldn't move my arm. It was so painful. We called the doctor's office to get me an appointment. They're like, yeah, you have to go to walk-in clinic because we don't have any appointments and we're understaffed. So like you have to drive 30 minutes to the clinic.
Yeah, the healthcare industry does not seem like it's functioning the way it's supposed to down in Arkansas.
I also don't understand how people who work in healthcare can deny science. Because we're having protests outside of our hospitals lately.
Wow. That is a whole nother can of worms. But, I really appreciate you taking the time to come on and kind of like talk to me about what's going on here, especially, it feels like there's certain states like Arkansas that don't really get any coverage being talked about, issues that they're having, the differences between what's happening in a state like that and states elsewhere. It feels as though our national conversation always seems to focus on the same 5 or 6 places, more or less.
It does. And it's really scary because I have family in other states. So I follow other state news and everything like that. And it's surprising to me how much other states pop up in my news than my own state where I reside. And I'm like,
Right.
why is no one talking about what's happening here?
Right. And it shouldn't be
We,
that
we
way.
hear more about Texas than we do about Arkansas. And Arkansas and Texas are like buddy buddy and might as well be friends in this whole thing.
Right. Yeah, so I really do appreciate you coming on and taking the time to kind of explain to us some of the issues that are going on down in Arkansas. And for those who are interested in connecting with you a little bit, is there a place where they can find you on social media, or a place where they might be able to find your writing?
You can find me on Facebook, Twitter, Instagram. My Facebook is TS Hathaway. I use that name also on Instagram. My Twitter is Widget 2009.
Okay. Well, thank you so much for coming on today. I really do appreciate it. You're definitely welcome back on in the future. For everyone else, I'll be right back after a quick break with my final thoughts of the day. Stay tuned.